Well, thank you very much, Administrator, for the gracious introduction. And I will tell you, regardless of who gave you what longitude and latitude as to what, you are in southern New Jersey. There is no doubt about that. So maybe if you go by Woodbridge, there's a debate. But in any event, but it's not a debate here. So it's great to be back in Cape May with the mayor. Mayor, good to see you, our neighboring community commissioner. Thank you for joining us. To all of the officials who are here, to the chairman, thank you for joining us, and the vice chair, thank you for joining us as well as to all of the hospital staff, for which we'll hear from some of its leadership in a moment or two. And please give my condolences to the president for her loss. Let me start by thanking Jana Selta, who is our state director of a fabled family in southern New Jersey, and we are so proud of the work she is doing at USDA for us, and Mr. Joaquin Altoro, who is the USDA Regional Housing Administrator. These two representatives make it incredibly possible for us to achieve what we are achieving today. Let me first start off by saying we are able to do this because we had to fight for the designation of what was rural. When I came to the Senate and visited southern New Jersey, I was told consistently how we could not get the monies because we were not defined under the USDA definition of what rural is. And I said, how's that possible? And New Jersey was seen as a whole. And of course, if you think about Newark or Jersey City, you don't think rural. But if you're here in Cape May and in other parts of our state, it is rural. And the definition basically did not allow us to qualify for these monies. So I went to work, changed the definition, and we are here today. So I'm glad that we are here today to celebrate Cape Regional Health System. Glad we're here to celebrate Cape Regional's health system and its $989,300 USDA Emergency Rural Healthcare Grant. It's funding that is incredibly important and an enormous benefit to the community. Cape Regional will use this grant to purchase new diagnostic equipment, think CT scans, x-rays, ultrasounds, that will reduce waiting times for patients and their families. As part of a new 9-bed treatment wing to support the emergency and radiology departments, it will allow Cape Regional to better serve dealing with the continuing challenges of the pandemic we have with COVID patients, as well as others seeking critical care. These are crucial upgrades, all part of our effort to ensure that every New Jerseyan, from our cities up north to small towns like Cape May down south, can access the high-quality health care facilities they deserve. It should not matter what zip code you live in. You should have high-quality health care and the facilities that can deliver it. Now, let me just say a few words about this grant program, the Emergency Rural Healthcare Grant Program, which in my view is a prime example of government at its best. We have a problem in our country, the declining availability of rural healthcare providers. Since 2010, we've seen more than 100 rural hospitals across the nation close their doors, leading residents to travel further and further away to access care. So imagine for a moment that you're facing a medical emergency and the closest hospital or clinic is 45 minutes or more away, or even further. Imagine that you're one of New Jersey's rural providers dedicating to providing care, but that for technical reasons you're not recognized as a rural hospital despite facing the same challenges as sister hospitals in other states. That's unacceptable. That's why I successfully fought for a rural floor fix that brought this entity, Cape Regional, over $2 million for fiscal year 22. It's how we define payment for rural hospitals. Again, we were not included, and we changed that in the law as a member of the Senate Finance Committee. Hospitals like Cape Regional are vital members of our community. The services and care they provide are invaluable. And when COVID first landed, it hit rural providers like Cape Regional especially hard, putting them under financial stress unlike anything we've ever seen. In 2020, after not receiving funds from the Provider Relief Fund, which is a provision of the American Rescue Plan that I authored, which basically provided assistance to hospitals throughout the state, Cape Regional didn't get anything. And we went to work and successfully fought for $7 million for Cape Regional. So we're thrilled of the things that we have been able to do to make sure that this hospital can continue its high quality delivery of service to the people in this area. Programs like the Provider Relief Program and USDA's Emergency Rural Healthcare Grant Program are critical. They provide necessary funding to hospitals like Cape Regional, helping them meet the challenges we face today, while also expanding services for the community. And as part of the American Rescue Plan, which I was privileged to vote for with my Democratic colleagues, which Congress passed and President Biden signed last year, these grants have helped facilities expand their COVID testing and vaccine programs, improve telehealth to reach patients where they are, invest in collaborative efforts that ensure the long-term sustainability of rural healthcare, which brings me back to my point about this program being an example of government at its best. I think that's a true statement. Why? We faced a crisis during the pandemic in terms of providers and their staffs being pushed to the limit. I just saw a bunch of the nurses and the doctors. I recently had a shoulder operation, so I really appreciate nurses and doctors, I can tell you that. You worked overtime against unprecedented odds to deliver care to those who needed it the most. And now, almost 2.5 years after COVID started, we still have a responsibility to help. We have a responsibility to ensure our hospitals have the resources they need to meet ongoing and future healthcare challenges. A responsibility to ensure that every American, no matter who they are or where they live, can access life-saving treatment when they need it. A responsibility to support rural communities like Cape May through thick and thin when they need it the most. That's why we're proud to join together to announce this emergency rural healthcare grant to Cape Regional today. $989,000 makes a difference. I would have liked to have rounded it up to $1 million, but anyhow, we'll take what we can get. It makes a real difference for the providers and the doctors who are on the front line. And it makes a difference to, most importantly, to their patients and their families who depend on facilities like Cape Regional to care for them when they need it the most. So with that, I'm happy to turn it back. I'll turn it to Mr. Piratsky on behalf of the hospital to say a few words. Please join us.